Hi everyone, Dr. Shook here. I hope you're doing well today. In this live stream, I want to share some really important information with you that will help to clear up some confusion that people have. A lot of times, people don't realize that they can have thyroid-related symptoms and all of these problems with their thyroid and it not be related to the actual thyroid hormone quantity. Most people think that they have a thyroid problem. All that can be done and what should be done is that they are given a thyroid hormone replacement. However, that is only one of probably 30 or 40 different ways your thyroid hormone chemistry can break down. And so there are all of these other ways that we have to consider or you miss a tremendous opportunity to get your life back and feel better. So we have to consider some other things and that's what I want to share with you today. And in particular, I want to share with you how to improve thyroid function by addressing stress. Now you may not be aware of this, but stress has a direct impact on thyroid hormone chemistry. And it is a physiological change. Stress is not something that just happens and there's no consequence to our nervous system and to our endocrine system or our hormonal system. There are direct negative impacts on our physiology that will disrupt our thyroid chemistry and can actually cause some of our lab levels to be misleading and not really tell the story about what's happening to our body. Okay, so let me share with you kind of how this works. So stress, the primary impact on your body from stress, the first thing that tends to happen is that you activate these glands called adrenal glands. Now, adrenal glands, they sit on top of your kidneys, right? So the kidneys are here. These glands are primarily responsible for your stress response. So when you're under stress, your adrenal glands will produce a stress hormone called cortisol. Now, when cortisol is produced, it does a lot of different things physiologically throughout the body, and it helps us to adapt to the stress. That's why your body makes it. But when it comes to the thyroid and how the thyroid functions, it can actually disrupt your thyroid hormone production. And the way that it does this is it's very it's amazing how the body works, how complex it is. But one of the things that it will do is it will actually, the cortisol, when it's released from the adrenals, it can suppress and decrease your pituitary gland, which is a brain-based gland. It can suppress its output of TSH. Now, when you go to your doctor, what's the primary hormone that they're going to check? Almost all doctors, the only thing that most of them will check is thyroid stimulating hormone, or TSH. And what they're doing is they look to see if the TSH is high. Because if TSH is high, then how it would normally work in the body is if TSH is high, then thyroid hormone levels are down. And in that case, a high TSH means that they're going to give you a thyroid hormone replacement. And when they give you a thyroid hormone replacement, the idea is it will bring up your thyroid hormone and the brain will decrease the stimulating hormone that is signaling the thyroid to make more T4 and T3. That's the way the body works. It's called a feedback loop. If you have low thyroid hormone then in the blood, then the brain is monitoring that. And if that hormone is low, the brain is going to signal your thyroid to make more thyroid hormone. And it does that by producing thyroid stimulating hormone, or TSH, which is what most doctors check, right? So if TSH is high, thyroid hormone is low, and the doctors say, yep, your TSH is high, let's give you a thyroid hormone replacement. And the idea is it will bring up the thyroid hormone that they usually don't check and bring the TSH down to a normal level. That's an ideal situation, and that does work for a lot of people, but there are millions and millions of people that does not work for, that's not enough. They either don't feel any better, they feel worse with the thyroid hormone replacement, or it does help people. And it's important that you have normal levels, but the thing is that the TSH isn't always reliable. This pattern can throw off TSH levels. So this is how it happens. The adrenals make cortisol, and cortisol it's published in the scientific literature that it can actually suppress TSH output. So if your doctor's looking for a high TSH to see if you need hormone or not, but cortisol is suppressing it, making it look normal, within normal range, then they may look at that and say, you don't need thyroid hormone replacement, your TSH is normal. But little do they know, you may be having suppression of your TSH through this stress response, right? Which they wouldn't know unless they took a really in-depth health history, which they don't have time to do because in the insurance-based model, it is, it's a quick production-based system where you come in, what's your symptoms? Okay, I'm going to give you a medication, or we're going to order a test or a procedure. That's it. That's what their toolbox is. And that's a good system, but the problem is that millions and millions of people don't get better with that. And so that's why you have to often have someone like me that helps with filling in some of these gaps so that we can work together to give you the best chance to have your health back. So TSH is often suppressed, okay? So what happens is on the labs, you'll tend to see this pattern where there's suppression of TSH, and it kind of looks like this. If you look at TSH, it's typically less than 1.8, okay? And your T4 is typically less than 6, okay? So T4 is typically less than 6. Now, neither one of those are below the lab range. You know, usually the TSHs, most lab ranges in the US anyway, are typically 0.45 to 4.5. So you can see that's within the normal range. Doctor would say, that's perfect. I mean, you're at 1.0 or whatever. They're going to say that looks good, but they don't realize that this is being pushed down because the cortisol is dampening and decreasing the TSH here, right? So what ends up happening is you have lower TSH, you have lower output of T4, but they usually never check T4. So they don't even know this is happening. They just see the TSH and say, yeah, you're fine. So let me explain something. So stress is the major culprit here, right? So there are 3 types of stress, okay? There's chemical, there's emotional, and there's physical pain. Physical pain, okay? So let me repeat those. Chemical stress, emotional stress, and physical pain. Now, how do these all do this? What they do is that inflammation, your body will produce and create a stress response because it helps your body. Cortisol is anti-inflammatory, okay? It is a steroid hormone, so it is anti-inflammatory. So it helps to suppress and decrease inflammation. So if you are chronically infected, if you have some kind of infection that's ongoing, bacterial, viral, parasitic, fungal, if you're autoimmune and you have an inflammatory process that's ongoing, your body will produce cortisol. Your adrenals will become exhausted, and this will cause suppression of this system, okay? So stress, it is a physiological response. Chemical inflammation will trigger the adrenal glands to produce cortisol. It's physiological. We know it happens, okay? Emotional stress. So when you're emotionally stressed, guess what happens? You have a fight or flight response, right? You've heard of that, right? Fight or flight response. So when you feel a perceived stress, your body will respond. Your sympathetic nervous system, it's part of the involuntary nervous system in your body. And it is a fight or flight mechanism. And what happens when you activate your sympathetic nervous system? You produce adrenaline, because it gets your heart rate up, right? And cortisol, it's a stress hormone. So what will happen? Suppress TSH output, and you'll have this type of pattern that no one's going to detect, first, if they're not aware of this, and if they're not looking at the right markers and they're not looking at your health history in enough depth and detail, okay? And then physical pain. So what does physical pain do? Well, physical pain, it hurts. So what happens? When you're in pain, your heart rate goes up, you are activating the sympathetic nervous system. That fight or flight mechanism is activated with physical pain, drives this process. Okay, same thing. So these are the different types of stress. They're real stressors. They have real physiological and hormonal impacts that can disrupt thyroid physiology and create some major problems for you. So this system can be this production of cortisol. That was just, we're talking about, you know, these are the types of stress, right? So activated by stress. Right? That's we just talked about these 3 different types of stress. This system's activated. It's also activated by blood sugar fluctuations. And this is high and low. Okay, so high blood sugar and low blood sugar create problems with activating this system. So, you know, if you have low blood sugar, this is something that a lot of people don't realize. You know, if you get hypoglycemic, if you have low blood sugar, has anyone, you know, if you've never experienced this, well, maybe you know someone that has. When you have when you get low blood sugar, you tend to get shaky, you'll get clammy, you'll start sweating a bit. If it's bad enough, you can faint, you can actually vomit, it can cause you to vomit. And that's because what happens is when the blood sugar drops, the brain is, you know, it goes into this emergency mode. And what it does is it signals the adrenal glands. It signals the adrenal glands to produce cortisol and adrenaline, because cortisol and adrenaline both have this ability to break down blood sugar that's been stored in your large muscles of your body and your liver. So it can break it down. It's called glycogen. It's stored when blood sugar is stored in the muscle and in the liver. It's called glycogen. So these hormones will break down the glycogen and cause it to come back into the bloodstream and raise your glucose, your blood sugar. So when you have low blood sugar, it makes sense, right? The brain is trying to protect and keep the body running and keep you alive. So it stimulates these production of these hormones, which can make you sweat, they can raise your heart rate, they can make you feel nauseous, and ultimately you can vomit. So that creates all those symptoms. So this activates this system. Right? So low blood sugar and high blood sugar fluctuations can wreak a lot of havoc on your thyroid physiology. Right? This is called functional endocrinology. This is how different systems of the body crosstalk. Okay, that's what we're looking at here. So it's important to understand how these different systems and different hormones have effect on one another. This is not something that you can just let's just look at TSH. I wish. I wish that was it. Now, and I want to tell you something, like your doctors, I'm not at all trying to be hard or hard on them at all, because they do things that I don't do, and really, they can't go into all this with anyone, even if they did know it, because you're going to the wrong type of doctor for these problems. If you need help with this, I can help you with these things. This is what we do. We look we cast very wide nets and we look at physiology, but these are things that are not classic right now. I mean, this is newer science. The stuff that's being covered by your insurance right now is, that's what your insurance company will pay for is their definition of sick, right? And their definition of a thyroid problem is TSH, and that's about it, unless you have Graves' disease or a hyperthyroid problem or something like a cancer or something like that. Well, that fits their definition of sick. This doesn't fit their definition of sick yet, and they're not bad people, and there's no conspiracy. The reality is that that's the science that they are, that they are covering and that they have decided to cover, and this is newer, right? This is newer stuff. So I'm sure they're evaluating these options, because a lot of people want access to this. But right now, these are non-covered services. I mean, when we do this stuff, this is all out of pocket that the person pays for. But you know what? We're all out of pocket. Like, I have a $10,000 deductible. So guess what? Everything I do is out of pocket. It's all out of pocket. So the reality is that we have to pay for the healthcare that we want, right? So, you work with your doctors. They'll help you as much as they can. If you need help, we can help you with this to try and figure out what's going on here. But stress plays a role. So these are the types of stress. Blood sugar plays a role. And then we've already talked about it a bit. Inflammation plays a role. So inflammation plays a significant role, because remember I said that chemical stress, which can be inflammation, your body will make cortisol because it's anti-inflammatory, and it can disrupt this physiology, and you can end up with some significant problems here. So what do you do? What do you do, right? Well, first of all, you figure out what's going on. You have to look at these things, right? So step one, I'll tell you the system I use. The system I use is a science-based, methodical approach to all these problems. So step number one is detect. Detect the problems. So do the testing, do in-depth health history. So I usually spend an hour on my first appointment with someone, understanding what's going on with their history. Then I'll make recommendations for testing to detect everything that we need to consider. So this is where testing comes into play. Step number two is once we have the test results and we've looked at everything, then we put together a plan to remove the issues, remove what we found with the testing, and then sometimes also replenish. We might want to give the body what it needs if there's something that's missing. So detect and remove. Number three is repair. So we want to repair the damage that's been done, whatever we found, right? I mean, so we see things like blood sugar fluctuation, stress, inflammation. Inflammation could be driven by infections and all kinds of things, autoimmune processes. So we work as, addressing the whole person. It's really what you have to do. So we want to detect what the problems are so that we can put together a specific plan to remove and replenish whatever your body needs. Once we've done that, we want to repair the damage that's been done to the best of our ability. So we use this detect, remove, repair. We work with people all across the United States, around the world, and I do that through teleconsulting. If you need help and you're tired of dealing with these issues and being confused or just being stuck, or you just want someone to help look at this from a different perspective, you can go to new new.thyroidconsult.com and learn more about the application for care process that you would need to go through to work with me. But if you need help, don't sit there and suffer. There are things that you can do. There's a further explanation. There's a greater explanation for these problems that you're having. So if you need help, if you need assistance, don't hesitate to reach out to us. We will do everything that we can to help you. Just go to new.thyroidconsult.com and you can learn all about working with us no matter where you are in the world. And we will help you dig and look at your health history. We will help you dig and look at the most advanced testing that you could ever want, depending on the degree of investigation you want to do. And we'll just do our best to help you figure this thing out. But if you need anything, don't hesitate to reach out to us and let us know. If you have questions, please ask them here, and we will do everything that we can do to help you right now without working with us. You can go and you can watch any of the hundreds of videos that we have online and available, and really learn to help yourself. And I'm a big advocate of teaching people to help themselves, because I surely can't do it by myself. And so what we have to do is we have to teach these concepts so that you can become aware. And then, you can become your own advocate, your own health advocate, and you can be, involved in your healthcare. A lot of people go to the doctor and they're just, doctoring is done to them. They're doctored and they just do whatever the doctor says. And I'm not saying that you have to be, adversarial with your doctor at all, because that won't get you anywhere, and that's going to create conflict. What you need to do is try to see if there's a way that they can work with you, because they may have some flexibility, and your doctors are all becoming much more aware of this type of stuff, because I'm sure that plenty of people go to see them and say that they've watched some crazy doctor or someone online or read some book, and they want to pull their hair out because they're just trying to help you with the tools that they have, and they don't have time, literally, not because they don't want to, but because they don't have time, because of the system that they're a part of, and because of your insurance is such that they are not the doctor to help you with that, because that's not what they studied and they're not familiar with it. So they're becoming more familiar with this. Unfortunately, they're having to. And I think it's a good thing overall, but just be patient. Know that your doctors are trying to do the very best that they can for you. They want you to be healthy, but you have to work. You have to understand, if you're in the US and, well, really anywhere around the world, we see this, you're in a system that is based on really addressing symptoms to the best of the ability, addressing the cause when it can be done. But many of the tools that are available are to help you with symptoms, right? Help you feel better, help you prolong life. But a lot of the times, especially with chronic disease processes, hypothyroidism, autoimmune conditions, diabetes, things like that, it's the root driving processes have not been taught classically. And we're learning more and more about root driving processes every day. But you've got to consider things like this if you really want to help people to restore health as much as possible, right? And understand what you're looking at from a laboratory perspective. So anyway, I hope this helps you guys out. I hope you have a wonderful, wonderful day. Appreciate you hanging out with me. If you have any questions, please let us know. If you need anything, you can visit newthyroidconsult.com and learn more.